Hey everyone, my name is Abigail Valenta and I am an occupational therapy student at Chatham University. In this presentation, I'm going to talk to you about occupational therapy's role in maternal health. So sit back, relax, have a sip of coffee or tea, and enjoy discovering more about this topic with me. This presentation is intended for mothers, healthcare professionals that work with new mothers, occupational therapy practitioners, and healthcare students who are interested in this topic. By the end of this presentation, you should be able to describe occupational therapy's unique role in maternal health, compare different evaluations, screening tools, and interventions that occupational therapists can use to address maternal health, and discover how to apply learning through the use of a case study. I will begin by talking about what maternal health is. Maternal health encompasses the physical and emotional health of women during pregnancy, birth, and the postpartum period, which is immediately after giving birth. The time in a woman's life immediately before and after giving birth is often called the perinatal period. While this can be a joyful and happy time, some women's transition to motherhood can cause a decrease in their quality of life due to poor health outcomes. The complex psychological, social, and physical issues faced by women during the perinatal period requires an interdisciplinary team approach to ensure the highest quality of care for these women. The current maternal health medical model is insufficient in addressing the complex cultural and social influences affecting women during this time. Maternal health is an emerging practice area within occupational therapy, so this presentation supports the inclusion of occupational therapists in the interdisciplinary team to address maternal health. Women experience many changes in their mental, emotional, and physical health during the perinatal period. Some of these changes can lead to negative health outcomes. Difficulty managing negative physical issues such as back pain and carpal tunnel syndrome during this time can often lead to perinatal mood and anxiety disorders. As many as 25% of women are negatively affected by a perinatal mood or anxiety disorder. Postpartum depression is the most common, affecting 1 in every 7 women. Sadly, suicide is the leading cause of deaths in perinatal women. Women often go untreated for their psychological difficulties, which calls for a more holistic approach to be used when addressing the complex needs of perinatal women. It is important for healthcare providers and perinatal women to recognize the risk factors of perinatal mood disorders so that these women can receive help early on if needed. Most post-birth follow-up appointments occur 6 weeks postpartum, but perinatal mood disorders can be identified within the first month postpartum. So it is important to understand these risk factors, including history of depression or anxiety, lack of social support, low self-esteem, difficult infant temperament, birth complications, and lower socioeconomic status. Occupational therapy is a holistic profession encompassing both the physical and mental needs of our clients. Occupational therapy practitioners help increase individuals' independence in completing their meaningful daily activities, which are also called occupations. These occupations are tasks that someone wants to do, needs to do, or is expected to do. Perinatal mood and anxiety disorders and physical issues during the perinatal period can often lead to occupational performance deficits, which means that these women can no longer engage in the occupations that are meaningful to them. This can negatively affect the overall functioning, health, and quality of life for these women. Occupational therapists can help achieve occupational performance, which is the accomplishment of the desired occupation resulting from the interaction among the client, environment, and the activity itself. Occupational therapists make a valuable contribution to the interdisciplinary team during the perinatal period by providing a unique holistic perspective, client-centered care, and evidence-based practice. Next, we will learn about specific tools that occupational therapists can use to address maternal health. Occupational therapy practitioners have a variety of screening and evaluation tools available to them. Listed below are just a few ways that OTs can screen and assess maternal health. For the sake of time, I won't describe each one in detail, but I will briefly highlight the one that is unique to the occupational therapy profession. The occupational profile. This is a comprehensive interview/observations of the client that is then turned into a summary of the client's occupational history, experiences, patterns of daily living, interests, values, and needs. This slide lists some interventions that occupational therapists can use to address the physical and psychological needs of perinatal women. Occupational therapists can provide these interventions in inpatient, outpatient, and community settings. All of the interventions are aimed to increase meaningful occupational engagement and increase quality of life among these women. Co-occupation refers to the occupations or activities that a mother does to care for her child, including feeding, eating, sleeping, bathing, and comforting tasks. Occupational therapists play an important role in increasing healthy co-occupations, such as sleep and bottle or breastfeeding routines. OTs can also promote attachment among the mother and infant through age-appropriate play. Occupational therapists can also use psychoeducation to provide women with empowering information on how to manage unrealistic expectations, adapt to new roles as a mother, and education on abnormal symptoms such as pelvic floor issues and signs of postpartum depression. Occupational therapists can also help women who are experiencing physical deficits that are interfering with her normal activities, such as back pain when dressing. Occupational therapists increase these women's ability to engage in these activities by adapting and modifying the environment as needed. Cognitive behavioral therapy can be used to increase independence with daily activities through the promotion of self-care, mindfulness, meditation, journaling, stress and anxiety management, sleep hygiene, yoga, and engagement in leisure activities. Occupational therapists can help women with reminders and management of their medications, such as antidepressants. Occupational therapists can also provide community and social support resources for these women to increase social participation. One very unique evidence-based intervention that some OTs can use is to provide social participation through the use of an occupation-based retreat for women who have experienced pregnancy or infant loss. This loss is an unexpected, traumatic, and life-changing experience that can have a huge impact on maternal mental health, but often these women are left untreated by healthcare professionals. Lastly, occupational therapists must refer to other professionals when a woman's needs are beyond their current knowledge or outside of the scope of occupational therapy. Some examples of referrals would be to a pelvic floor therapist, certified hand therapist, and a psychologist/psychiatrist. Now, let's look at an example. This video highlights a short testimonial showing how a multidisciplinary community perinatal team, including an occupational therapist, helped to increase the quality of life for a woman suffering from perinatal complications. Now let's take a minute to review. I will give you a moment to answer each question using your own words. Try not to look back at the slides until you have written down at least something for each question. Feel free to pause the recording and take as much time as you need. What is maternal health? Can you describe it in your own words? What are some risk factors to developing perinatal mood and anxiety disorders? What is the prevalence of postpartum depression among perinatal women? Can you describe in your own words occupational therapy's unique role in maternal health and how they contribute to the interdisciplinary treatment team? Can you compare two screening tools that occupational therapists can use with this population? Is there anything you can think of that is similar or different to what other professionals use? Can you compare two different interventions that occupational therapists can use with this population? Is there anything that you can think of that is similar or different to what other professionals offer? Now, let's further discover how to apply what you have just learned through the use of a case study. Now let's further discover occupational therapy's role with perinatal health through the use of a case study. This case study highlights how occupational therapists can address postpartum depression. The case study is of Nadine, who is 10 weeks postpartum. First, occupational therapy practitioners build an extensive occupational profile, and then they provide client-centered interventions and also refer out when necessary. Now let's apply what you have learned to real life. If you are a referral source, such as a doula, nurse, or medical doctor, then refer to occupational therapy when you identify that a perinatal woman is having difficulty engaging in meaningful daily activities that they want and need to do. If you are an occupational therapy practitioner, then you can use your newfound knowledge to screen clients who you think are at risk for perinatal mood and anxiety disorders and refer your clients to specialists when necessary. If you are an occupational therapy student, then use this information to keep researching and furthering this emerging practice area in the field of occupational therapy. And lastly, if you are a woman who is pregnant, a new mother, or who has experienced perinatal loss, then use this information to empower yourself to seek help when you need it. If you would like to learn more about this topic, then check out the videos listed below. Thank you so much for watching this presentation. Lastly, if you have any questions or comments about this presentation, feel free to email me at abigail.valenta@chatham.edu. Thank you so much again for listening to this presentation.